Dr. Rosalind Knox here, Executive Director for the San Diego Brain Injury Foundation, in preparation for the Symposium on Navigating the Reintegration Journey. Our keynote speaker is here with us today, Galina Nikolskaya. I am so glad to have you here. You will be with us as our keynote speaker. So tell the audience a little bit about yourself, who you are and what you do.
Hello, thank you so much for this opportunity to share. I'm very excited to be part of this symposium this year. I'm a neurologist and I'm in a private practice out of San Diego, and I see patients in my clinic. My focus is traumatic brain injury as well as treatments of conditions that come with them. So headache issues, neck dystonia, spasticity, etc. I see patients and refer them out to therapies depending on their symptoms. I have neurodiagnostics like EEGs, VNG, EMGs, nerve conduction studies. I also do the injections for pain management, spasticity, and dystonias.
That is wonderful. Tell us a little bit about what you're going to be talking with the audience about as a keynote address.
This theme of symposium is collaborative approach to brain injury recovery. I would like to offer my angle, my perspective on helping patients with traumatic brain injury in terms of first identifying what the problem is, and then based on that issue, whether that be a symptom that's subjective or a physical exam finding, coming up with a roadmap for them so that they can be optimized in terms of their recovery. So a multidisciplinary approach where it's about them as a whole human being and addressing not just the neurological symptoms, but also psychological symptoms, sleep issues, etc. So I'd like to share what kind of common issues come up in terms of both the symptoms and also in terms of the findings that I see. And majority of the patients that I see are mild traumatic brain injury survivors, and there are some classic physical signs in the exam. So I want to talk about what those are so that TBI survivors, caregivers, and professionals are aware to be on the lookout for them. And the reason it's important is because these are not just diagnose and adios. These are issues that can be rehabilitatable and can be treated successfully. I'd like to shed light on how we as neurologists can generate a whole list of referrals to different therapies, different specialists. It can be a pretty lengthy list depending on what the symptoms are, but the idea is that there's no cookie cutter approach to brain injury. You can have one person that has mild TBI with severe sequela who need a whole bunch of therapists, or you sometimes have people who have had moderate brain injury and yet they're not needing that much. So it's very individualized, holistic, and integrative. So I understand that I'm just one part of this big village. What I do is just as important as what vestibular physical therapist does, as what visual therapist does, but I am in this unique position to catch the symptoms, understand them, put all the puzzles together and be like, what does this person need in order to successfully reintegrate into the community? Because let's say it's a person who has severe headaches post-trauma. Let's say it was a teacher before the injury. Well, if I can address their headaches successfully, and not just with medications or injections, but also addressing what kind of lifestyle factors they can implement. So if I can do that, if I can take away the headaches for this person, we can maybe return them to the workforce and maybe they can come back to being a teacher successfully and they can continue feeling like they're meaningfully living.
Wow.
This is what it's all about.
Yes. So it's so much great information. And I'm so happy to hear because with this year's overall theme of cultivating networks and resources. So we're helping people cultivate their networks and their resources. And this is just the guidance that you're talking about and understanding it from a holistic approach. It's not just important for the survivor. It's also important for the caregiver and for the professional and for each of them to understand how that intertwines, for them to understand how to best navigate that communication so that the most holistic and most comprehensive approach can be taken. And so I love what you do. And I love the fact that you are looking to ensure that people understand the services that people need, as well as how to request and talk about the services that you need. So again, from each approach, it's going to be really interesting. So what would you like for people to walk away from? So your professionals, your survivor, what would you like people to walk away from after hearing your keynote address?
I'd like for them to walk away with a newfound appreciation for the complexity of brain injury, but also with a new understanding of it. Because my role is to break down this complexity and make it a little bit more digestible So they take all this overwhelming plethora of symptoms and findings and categorize them and make it easy to understand. And my other goal is, once I highlight this clinical symptoms and findings, is to explain the why behind why people go to these facilities, why people need the therapy. Because I think if people
Yes.
understand the why, you can have this much more motivation behind
Yes.
galvanizing the person going down this path. Because there are some people out there that believe that once you have brain injury, it's sort of like having a stroke. And while it can be the case that the damage is so severe that it's kind of game over, I tend to have a little bit more of a hopeful take on this issue. In other words, I want to see what can we optimize to the best of the patient's ability. For that, I need the buy-in of the survivor, and I need the buy-in of the caregiver or the person who's taking them to appointments, so that they're not having this nihilistic take on therapy. Because some people out there that are just saying, oh, what's the point? Oh, what's the point of taking them to therapy? What's the point of taking them to the psychologist? They're just going to be made to feel worse.
Right. That's their perspective at the time without the knowledge.
Some therapies can make you feel worse, but it's because they're making you feel worse that you're actually getting better. Because it's like, you know, how when you're a student, let's say you're a math student and you absolutely hate math and it's hard and you don't want to do it. But because it's hard, because your brain is getting challenged, the growth is happening. And it's
exactly
that for the brain injury survivors.
Exactly. Oh, what a wonderful thing. And the panelists that will be there, because of course we love the fact that the symposium, the entire purpose of the symposium is that it is interactive. It is there for everyone to come and ask the questions and get more clarity and understanding for these types of things. And we have a panel that will be there with you as well. Team of providers and professionals that you're speaking of, the social workers, the rehabilitation, other neurological feedback professionals will be on that panel with the same goal, is to have people be able to take away an understanding of what that resource of or that network of care and providers look like in order to offer you the best comprehensive, I guess I want to say healing, but I really, really want to say journey to healing or journey of healing, because we all know that with a brain injury, it is a journey. Some of them are long, some of them are short. Most of them in one way or another is lifelong. And so the tools and the understanding that you're able to give and that the other panelists are able to give will help people to cultivate that information of networks and resources. So we're so excited to have you there. It is going to be at this beautiful Admiral Baker Clubhouse in Mission Valley. It is directly on Friars and Santos Crossroad. And we are going to have a wonderful time. We have limited space available. We have seats limited to 100. And so it would be very important to get in. This is for professionals, caregivers, advocates, family members, and survivors, because this is where we come together and learn better how to understand each other. So thank you so much for being a part of the symposium this year. We're really excited to have you. And with all of you together, we have over 60 years of experience that will be talking to the audience. So it's going to be really great.
Thank you. I'm excited for sharing what I know from my vantage point, and I'm excited to inspire people to think of this as adventure of brain rewiring and optimization of the brain. I love the concept of brain improvement, whether you be a healthy person or a TBI survivor. Let's help people get on this adventure so that they can thrive meaningfully.
Wow, I love that. All right, everybody. You heard Dr. Nikolskaya. You heard her. Come get the information. June 21st, it's a Saturday. The registration opens at 9:30 a.m. and we will start off with a little breakfast. We have lunch, and it is a full day of information, and we have exhibitors that will be here to be able to provide you even more information. Just the whole entire premise is to cultivate your networks and your resources, and this is the place to do that. So June 21st, we look forward to seeing you. So happy to have you. Thank you so much.